Hi, I'm Bobby Peer with TAPinto, and I'm here today with Dr. Anthony Terrana. Welcome, Dr. Terrana.
Hey Bobby, how's your Monday?
It's great. It's a nice summer day, and I want to get right into what most parents want to do on their summer vacation. And
Yes.
that's let's start our kids into an orthodontic treatment plan. So, can you
Yes.
talk to me a little bit about when parents should start seeing an orthodontist and what is the process that you go through?
Yeah. So the what the American Association of Orthodontists recommends for your first evaluation, they say that should be around age 7. There's certain things we want to look at age 7 that we could identify at a young age that by doing certain things early, we can prevent small things from becoming big problems later on. All right, so some of the things we look for at that first evaluation is if the jaws are too small, if the upper jaw is outgrowing the lower jaw, if the lower jaw is outgrowing the upper jaw, if the upper jaw is too narrow, if the canines are coming in on an angle, which could lead to, dental impactions later on, if kids are missing any teeth, if they have any extra teeth, if there's anything, blocking the eruption of teeth. Those are all things we want to look at a young age because if we leave them, they become way bigger problems later on. Most kids at age 7 don't need orthodontic treatment, but it's good to just be evaluated. But there is about 30% of kids that do have some of these issues that do need to be addressed in order to prevent small issues from becoming bigger issues later on.
Okay, so when they come in, what are the treatments that the kids
Yes.
could be receiving,
Hmm.
or what
Yeah.
is the process?
That's a great question. So it all depends on what the diagnosis is, right? We take orthodontic x-rays and we take a look. If we see the upper jaw is too narrow and too small and we know there's a lot of crowding, we could go in with orthopedic appliances such as expanders to make the jaw bigger. If we see the upper jaw is behind the lower jaw and the kids have an underbite, there's orthopedic appliances we can use for that to make the jaw bigger and bring it forward to prevent future jaw surgery. If I see the canines are coming in on an angle and we know they're going to become impacted and we know if we don't do anything now, they may require surgical exposure, we could go in with expanders to make the jaws bigger and make room for those canines to come in. So there's not a kind of a one-stop shop for everything, right?
Okay.
For phase 1 treatment, what we're really doing, it's a lot of orthopedic movements we're doing in phase 1, right? We can move teeth at any time. It's easy to move teeth. But what we want to do in phase 1, the main goal of phase 1 treatment is orthopedic change. So a lot of times braces or clear aligners aren't strong enough to get jaw growth, right? We love to do braces, we love to do Invisalign, but that's more to move teeth around. You're not going to get a bigger jaw from putting clear aligners in or just putting braces in. A lot of times you do need that expander or reversible headgears to really get that jaw to to move, right? So I could actually show you a few examples we have here on what we've done with phase 1 treatment, which is great. Let me pull that up for you, Bobby. Here we go. So one of the big things that really get the jaws bigger is expanders, right? Expanders at age 7, at age 8, that jaw, there's a growth plate that hasn't fused yet. So by putting an expander in, we can make that jaw nice and big and we make room. So here's sort of how an expander works in a child with a really, really small mouth that just didn't have enough room for these teeth to come in. And when we took a look at x-rays, there wasn't enough room for, canines to come in. So we put an expander in, we turn it twice a day, and we get the jaw to become bigger and bigger. Now, expanders aren't what we used to do in the past. They're much smaller now. Now we use what are called micro expanders. They're 3D printed. They're really comfortable for the child. They're really tiny. And I tell every child, if this bothers you in a week, I'll be more than happy to take it out. I've never had someone come in a week later to have it removed. And I could show you what those look like. But what we're trying to do here is when we take these x-rays and we looked here, this kid had no room for these incisors to come in, right? They were crowded. And into this tiny little space, we had to fit this big canine. And in this tiny space, we had to fit this big canine. So by going in with just an expander, we made a ton of room where this tooth dropped in, this tooth dropped in, and we had all this room to fit these canines.
Wow.
All right. So we were really able to gain space with orthopedic forces, and it was a combination of an expander with braces.
What is
And I
the
always,
length of time
yep.
that those expanders would be in the child's mouth?
How long is the expander in the child's mouth? That's a
Yeah.
great question. We turn them for twice a day for 2 to 3 weeks, and then we like to leave them in for a good 6 months.
Oh,
We're not
okay.
going to turn for 6 months, but the reason being, once you expand, you're taking the two halves of their upper jaw and you're separating them, you're moving them apart. So if we take that out too soon, as soon as we take it out, they're just going to come and meet each other again. But by leaving them in, we're able to regenerate bone so that we have stability. If we take it out too soon, they want to shrink in. So we need to hold that so new bone could regenerate. It's almost like if you were to break your arm or your leg and you have a cast on for a couple months, we want that bone to become nice and strong. So when you do take that cast off, everything's nice and strong and nothing relapses. All right. So that's a good phase 1 treatment. And this is something, with either braces or Invisalign alone, you're never going to get that growth plate to move, right? You could move teeth around. Now, if parents come in and they're like, I just don't like the way the front teeth look, yeah, absolutely. We could use Invisalign first. We could use braces and we could straighten those teeth. But a lot of times, the goal of phase 1 treatment is not to align the teeth, it's to make the jaws bigger to accommodate all the teeth to allow them to come in.
Wow. So, and this can start at 7 years of age.
Yes, we like to see them at 7 if it's needed. Typically, I like to expand around 8, but it's good
Okay.
at age 7 to be evaluated to have a game plan in place. And then here's another type of condition that could be treated with a with early treatment. Here's a patient where his lower jaw was outgrowing his upper jaw, and you can see this lower lip was sticking out a little too far. And after using what's called a reversible headgear with an expander, we completely changed his profile, right? He had what's called an underbite here, where his upper teeth were behind his lower teeth.
Oh,
And by
wow.
going in and using orthopedic forces, we were able to get that jaw to come forward, and we were able to prevent him from needing a future jaw surgery later on in life. So mom was very grateful here that we were able to
Incredible.
prevent that at a young age. It was very easy to do.
Yes.
Okay.
Wow. So, from there,
Mhm.
you just continue to see the child,
Yes,
and then
exactly. Yep.
it leads into
Yeah.
braces
Yeah,
or
exactly. So, I always say the purpose of phase 1, it's not going to prevent you from needing phase 2. A lot of times they're still going to need to straighten their teeth when they come in, but what we're trying to do is we're trying to make the foundation nice and big. Right? Before we start putting up walls in a house, if we could still have the opportunity to make the foundation nice and big, to create enough rooms for everyone that we don't have to kick anyone out of the house, right? So we have a little window where we could still extend the house. But once the house is built, now you're kind of stuck with that size and you kind of have to rearrange furniture and move things around. And we
yeah.
want to, make that foundation nice and big in the beginning when we still have that little window of opportunity to prevent us from needing to pull teeth later on, or
Okay.
needing to do jaw surgeries to correct skeletal growth, or needing to do jaw surgical exposures to go after teeth that didn't have room to come in.
That's incredible. Well, thank you so much for this information, and we will put all your information up on the screen, and I look forward to our next
Yeah.
conversation.
Thank you, Bobby. It was great thanks for having me today.